Hi everyone, my name is Arlie Dudar, and I am a doula practicum student from College of the Rockies in Cranbrook, BC. This is video number 6 in my 6-part video series on how a doula can help you have a better birth. So this is my last video, and today we're going to be talking about breastfeeding. So we'll talk about why you may want to breastfeed, why you may not. We'll talk about what a good latch might look like. We'll talk about mastitis. I'm going to talk a little bit about breast milk banks. And we'll talk about, just finish off with a couple of things that people don't tell you that are just tidbits from the community. Okay, so without further ado, we'll get started. I want to differentiate between breastfeeding and nursing. Just because you're breastfeeding doesn't mean that you're nursing your baby all the time. They're not the same thing. Nursing is breastfeeding. Breastfeeding is not nursing. Nursing, you're putting your baby directly on the boob, whereas breastfeeding, you're giving them breast milk, whether it is via nursing or with a bottle. And both of those are okay. I also want to add that whether you are giving your baby breast milk or you're giving them formula really doesn't matter because you're feeding them. So there are some benefits to breastfeeding that can't be found in formula. That's just a fact, and I'll talk about that. But if you choose not to breastfeed, or if for whatever reason you're unable to, there's no shame in that. You're still feeding your baby. So this video is not super pro breastfeeding. It's just me wanting to give you as much information as I can so that you can make the right decision for you. That's all I'm doing. That's all I want to do. So I'm going to present this information in as little of a biased way as I possibly can and just be as neutral as possible, because ultimately you have already done so much hard work and you are such a hero for having this baby. All right, first, we're going to talk about why breastfeeding. Why do you want to breastfeed? Why is that such a good idea? Well, let me tell you. Okay, so first, and this is sort of the easiest argument that anyone will have, is affordability and accessibility. You can use breast milk anywhere. You can produce it anywhere. You don't need access to clean water. You don't need extra money to go get some. You just need yourself and your baby. That's it. That's all you need. Now, all the political stuff about places where it's safe to breastfeed your baby aside, all you need is you and your baby. So that's like a slam dunk argument right there, right? There are places where it's really hard to access formula or it's really expensive. And so you don't need to if you're breastfeeding. You can just give them your boob or a bottle that has breast milk in it. Now, that is one argument. Another argument for breastfeeding is following your birth of your baby. Breastfeeding, nursing, actually stimulates oxytocin release from your brain. And so what that means, we talked about oxytocin during your labor and your birth, right, as being absolutely essential in contracting your uterus. So it's doing the same thing, because once you've had your baby, the placenta had to be ripped away from the uterine wall. And so there's going to be bleeding there. There's going to be open blood vessels. And by nursing your baby, you are actually helping contract your uterus even further. So you are stopping that bleeding. That's your body's natural way of minimizing bleeding. And then the more you do it, the more it actually helps your uterus return to its normal size, and it helps reduce the blood loss that you get. Another really cool thing about breastfeeding is supply and demand. Your body actually produces as much as your baby needs. And here's an example of that. This is a cold, hard fact. In the first 7 days following your baby's birth, if you breastfeed every 3 hours or 8 times in 24 hours for the first 7 days, you are almost guaranteed to have an average of 1.5 liters a day for the rest of the time that you're breastfeeding your baby. So that's a lot of breast milk, right? That's a lot of supply that your baby needs. And in the first 6 months following birth, your baby is almost solely using breast milk as their sustenance. And so you're able to give them that if you kind of are able to steadily breastfeed them 8 times in 24 hours for the first 7 days of life. All right. Now we're going to talk a little bit about the components of breast milk and the components of formula. And I'm going to start by talking about immunity boosters. Immunity boosters are a really cool thing that you can get from breast milk that are not in formula. They both have minerals, they both have vitamins, they both have protein and fat, and they are both really good for your baby. Breast milk also happens to have a lot of really cool immunity boosters, namely things like immunoglobulin A, which is really important for your immune system. It also has anti-infective factors to help with your baby's body fighting infection. It also has hormones to help with their growth. It also has growth factors. It also has anti-tumor factors and enzymes and stem cells, which is like just wild that all these things go into your breast milk. And if you're feeding your baby breast milk, they're getting all those benefits plus all of the benefits of minerals and vitamins and carbs and protein and fat. So that's enough about why you may want to breastfeed. Let's talk a little bit about why you may not want to breastfeed. If you have a medical condition, and I'll talk about those a little bit, then you may not be able to produce breast milk, or you may not want to give your baby the breast milk that you are producing. So, for example, if you are somebody who has HIV, whether or not you're on antiretroviral therapy, there is still a chance that you're passing on HIV. You're transmitting it through the breast milk. So if you're on antiretroviral therapy, that risk goes down to about 1%, a risk of transmission through breast milk. But there's still a risk, right? It's very, very minimized, but it's still there. So in that case, if you're HIV positive, then you choose to use formula. You can also choose to, you may be eligible for using a breast milk bank. We'll talk about breast milk banks in a little bit. I really want to touch on that. But for right now, I just want to focus on why else you may not want to breastfeed. So another reason might be if you are on antidepressant medications. So a lot of antidepressant medications pass into the breast milk. And you may be in a place where you either don't want to or you cannot switch your antidepressant. And that's okay. It just might mean that you need to look at alternatives rather than giving your baby your own breast milk, you're giving them someone else's or you're giving them formula. So be sure before you kind of go ahead and make those steps, be sure to talk to your practitioner, whether you're seeing a nurse practitioner or GP, or you're just kind of going to the local walk-in clinic or the breastfeeding clinic. Make sure you're asking them about the impact that your antidepressant might have on your baby. Okay? Next, we'll talk about breast surgery. So if you've had breast surgery, whether or not you've had a mastectomy, if you had a breast reduction, if you had implants, some of your milk duct may be there. It also may be that during the surgery, the nerves and the ducts, or one or both, were damaged. And so, although you may still have those ducts there, you're not able to breastfeed. Now, you still can breastfeed with tattoos. I'm just going to add that in because a lot of people ask, well, if I have tattoos, can I still? Yeah, you can. Don't get a tattoo while you're pregnant on your breast, okay? If you do, then talk to your doctor about whether or not it's safe for you to breastfeed, just because that tattoo is quite fresh. And avoid getting tattoos while you are breastfeeding, while you're in the stage where your baby is getting milk from your breast. All right, other reasons that you may not want to breastfeed is if you are someone who uses illicit drugs. So we're talking about cocaine, we're talking about meth. Talk to your doctor about whether or not using marijuana is safe while breastfeeding. Ebola virus is another reason. If you have the Ebola virus, you will not want to breastfeed because you can pass that on through your breast milk. We're also going to talk about, while we're here, we're going to talk about breast milk banks. So there are places in the province, big medical centers, as I mentioned, that have breast milk banks where if you qualify for getting milk, donor milk from there, then you can get it. But if you live in a smaller place, it may be really, really hard for you to get donated breast milk. And it also is not the easiest thing to actually donate your breast milk to these medical centers, especially if you're, again, in a smaller place. So the alternative to having interior health or health authority designated centers is community groups. So I really hate to plug Facebook here, but Facebook groups, there are a lot of really local groups that are about breast milk donation. And so if you find a group that is local to your area and you can post and say, hey, I've run out of breast milk, or hey, I'm not able to breastfeed right now. Is there anyone who has extra breast milk? And somebody else may pipe up and say, yeah, I have an oversupply. I have a lot in the freezer. You can have some. And so those Facebook groups or community groups, wherever you want to find them, are good places to network, to get to know other moms, and to benefit from somebody else's oversupply. Or vice versa, if you have an oversupply and you want to donate it, then these community groups are a really good place for you to do that. Okay, so we've talked about why you may want to breastfeed. We've talked about why you may not want to breastfeed. We're talking now about the latch. So when you have a good latch with your baby, believe it or not, your nipple, is not actually touching anything in the baby's mouth. And when I was in nursing school, we talked about what a good latch looks like. And this, again, is a very medicalized thing. If you find that it's a problem, if you find that, it really, really hurts when you're breastfeeding, then look at your baby's latch and, try to figure out what's going on. And these are some ways that you can troubleshoot. So a good latch involves the mouth position of somebody who's going to eat a big hamburger. It's like the mouth is wide open rather than somebody who is slurping spaghetti with a little, a tiny little breast milk, breastfeeding. Okay? So what you want to see is a hamburger bite and not slurping spaghetti. Another thing about the latch that is important to know is having the nose to nipple rule, and this is sort of a general rule, but if you set your baby up so that their nose is touching your nipple or is in line with your nipple, when they open their mouth, they're actually going to, I don't know if I can sit sideways and tell you this, they're actually going to tip their head back. And that helps open up their airway, as you can see, right? It's a lot easier to breathe while you have your head back than if you have your head all the way down like this and you're trying to eat and swallow and breathe, and it's not comfortable. So when you are doing the nose to nipple, you're making their head go back like this, opens up their airway, and it also helps open their mouth all the way into that hamburger bite. Okay, so the nose to nipple is a good way to get a good latch. A couple of things that might inhibit a good latch include something called tongue tie or lip tie, which I admit I hadn't heard of before I started this course. And a tongue tie is there is a little piece of tissue underneath your tongue. And if you look in the mirror, you can see it. I'm not going to show you because that's really graphic, but you can see this little piece of tissue right underneath your tongue. And in some babies, that tongue tie, it's called a tongue tie because it's so big, this piece of tissue, that it actually doesn't let their tongue lift up at all. And furthermore, they can't stick their tongue out to actually breastfeed. They just can kind of like, they can't really stick it out, which means that their latch is going to be a lot more sucking than that hamburger bite. So you're going to get a lot more of that little spaghetti mouth than you are going to get that big old hamburger bite. If you find that it's painful every time that they're nursing, then you can just, check and see if they do have this tongue tie. For more on tongue ties, I'm going to include a link in the description section for you, and you can check it out for yourself. Another one is the lip tie, and so this is the same thing. It's the same extra piece of tissue in the mouth that is between the underside of the lip here and the gums on the inside. And so if you feel your own, you feel that you've got a little bit of flexibility there, your lip can move, but if that lip tie is so big that it's not really allowing their lips to go out like this, then it's really hard for them to breastfeed. And again, it will hurt, right? You will notice that it really is not comfortable for you because they're like yanking on your nipple. And then you're going to end up with sores and bruising and tenderness and abrasions and cracks on your nipple, which sucks. So having a good latch is really important. Also, you can hold your baby in different ways. So you can hold them in the football hold, kind of under your arm. And this will also really be beneficial if you may have had a C-section for your birth, because you're not putting any pressure on your stomach. Another one may be, if that one doesn't work for you, the football hold doesn't work, you can do the cross cradle, where you're holding them across your body. And if you find that your baby is squirming a lot, you can just kind of put your hand very gently on their back, and you can kind of help to hold them in place and just support their head and really put some gentle but firm pressure on their back so that they're not squirming around as much. And then that less squirming is going to hurt your nipple less. Okay, so those are a couple of holds that you can use. You can also try various things where you hold them straight up and down. And the side lying position is another popular one for new moms who are doing a lot of co-sleeping. So if you're laying on your side and you've got your baby right in front of you, and they kind of stir and they start getting a little fussy, you've got your boob right there and you can just breastfeed immediately on your side, and you don't really have to do anything. And so those are really good breastfeeding positions. And as long as really you're getting this latch that is more of a hamburger bite than a spaghetti straw, then you're in good shape. Now, that being said, that's not the only rule for somebody who's breastfeeding. So if you find that, well, I don't know if it's a hamburger bite or not, but it doesn't hurt, and they seem to be getting enough food, yeah, then great. Then go with it. It doesn't, just because somebody might assess it and say, well, that latch doesn't look right. Well, if it feels fine to you and you find that you're not having any damage from it, then go for it. Then keep doing it. If you do find that you are having damage to your nipple, there are a couple of things that you can do. There's different nipple balms that you can get. One that is lanolin based is particularly beneficial, and it is designed for healing. It's designed for nipples. It's safe for, for baby to feed on. It's one in particular that I'm thinking of is lanolin based, and lanolin is it's like Vaseline on steroids. Somebody described it to me, which made me laugh, but it's so true. Another option somebody used was honey, and honey also has that honey is naturally antimicrobial, so you can put it on afterwards. And then what you could do is you could leave it open to air, or you could cover it up with some plastic wrap so it doesn't get inside your bra and inside your clothing. And it will also help to prevent infection there, and it will help to heal those cracks. All right, so we've talked a little bit about the latch. We've talked a little bit about how your nips can hurt. Now we're going to talk about mastitis, because I feel like this is a natural segue into mastitis. So, itis means inflammation, and mast is breast, so it's inflammation of your breast is what mastitis is. And before you get mastitis, you may experience clogged ducts, which are, a kind of a hard nodule in your breast that just kind of comes up and it's sore and it may be warm, and it's quite hard. And mastitis is inflammation of your breast that is sometimes caused by infection, sometimes it's caused by clogged ducts, sometimes it can be caused by an allergy, but whatever the case, it's going to be sore and red and likely quite hard. And if you've got it in just the one breast, then you can use the other breast for breastfeeding. If it's in both breasts, if you've got soreness, redness, engorgement, and hardness and warmth to both breasts, you can try a few different things before you go and see your GP or whoever you're going to see. So you can try, you can try heat therapy, you can put warm packs on there, you can try having a hot shower to kind of soften it up a little bit. You can try massaging your breasts while you are breastfeeding. Also, clogged ducts and mastitis can be caused by not breastfeeding for a long time. And so you can get that buildup in there. And one of the easiest ways to treat mastitis, at least at first, is expressing that milk. So breastfeeding or expressing it into a bottle, and then, you're relieving that pressure. You can also try, frequent nursing or pumping. You can try soaking in hot water, so having a bath or a shower. And also just make sure you're getting your rest and your relaxation, because a lot of things can contribute to that soreness, that mastitis, or clogged ducts. All right, we're going to finish off by talking about a couple of things that are not really well publicized. And these are little tidbits that I got from the community. Here in Cranbrook, we don't have a Latch League meeting. We have a very experienced, very lovely lactation consultant. Her name is Daleen Bybee, and she runs a breastfeeding mamas group in Cranbrook and Kimberley once a month. And it's a place for women who are breastfeeding to come and talk about their experience, to talk about, how things are going for them, to kind of share stories. And it's not just about breastfeeding, it's sort of everything around, how growth is going with their toddlers, how their sleep is going, how, their milk supply is, and talking to each other and really problem solving with each other. So it does create a really good community, and I highly recommend it if you're in the Cranbrook and Kimberley area and you're somebody who is expecting a baby or has recently had a baby. So when we were at this meeting, there were a couple of moms who were talking about their stories. And one of those was, we talked about, what surprised you when you're with breastfeeding? And somebody said, my milk didn't come in right away. And somebody else said, yeah, my milk came in like within the first 24 hours. Whereas, the statistics say your milk will come in 24 to 48 hours, 1 to 2 days. But that's really a loose generalization, and everyone is so different. So if your milk comes in right away, great. If it doesn't come in for 3 or 4 or 5 days, it's okay. It's okay. And you do what you have to do to feed your baby. And hopefully you have colostrum that you're producing. I encourage you to reach out to a lactation consultant in town, and talk to them about, how you can improve your milk production, or how you can, make sure that your baby is getting enough milk. Another thing that a couple people talked about was engorgement. We talked about a little bit about engorgement, and we talked about oversupply. So how do you know if you have oversupply? You will see it through your baby's poops. They might have really explosive poops. And as soon as you breastfeed them, they've got pressurized poops coming out the other end because their little body can only handle so much. And you may also see milk squirting out the sides of your baby's mouth when they're breastfeeding. And so a way to manage that oversupply is actually to do a little bit of hand expressing. In the shower, you can do it when it's nice and warm, and that's really warming up all your milk ducts. You can just express a little bit. Or you can, try, if you've got really, really sore breasts and it just hurts to express, you can try a hot water bottle and a towel, and then your milk will just come out on its own and that towel will absorb it. And you can do that while you're laying down. You can also try just frequent little feeds, because your baby's stomach is only as big as their fist. Like, right? Ours is only as big as our fist. And you've seen the little baby's fist. It's so cute and tiny. And so they really can't handle a lot of breast milk at once. And so frequent feeds are a really good thing, at least at first, until your body gets used to the supply and the demand. of your baby's needs. So those are a couple of things that people don't usually tell you. And I really encourage anyone who is expecting a baby and who's had a baby to go see their local Latch league or whatever kind of breastfeeding group that you have in your community, because that is your strongest source of allies. Your community and other women who have had babies, other women who are experiencing that as you're experiencing it, can help you. And if nothing else, they're saying, yeah, that's normal, I had that. Or, oh no, that's not really normal, but I know somebody who can, who can help you out. Or at least they can validate your feelings. They understand you. So that is my final recommendation. And this has been my last video. So thank you so much for watching. And thank you for sticking with me on this journey. I hope to have more of these videos. As I learn more, I want to share all my knowledge with you. And in the meantime, I wish you the absolute best. Keep learning, keep looking out there for resources, for tips in your community, for just support so that you can have a strong village to birth your baby into. All right, take care.